Vitamin D helps ensure the body absorbs and retains calcium and phosphorus, both critical for building bones and teeth. It is especially important for children growing bones, and a deficiency can lead to rickets, a bone-softening disease that typically occurs in children in their first 2 years of life. Vitamin D deficiency is very common in children, especially in those in northern regions where longer winters and lower levels of sunlight result in reduced synthesis of vitamin D3 on the skin. Children who regularly use sunscreen also have decreased synthesis of vitamin D and may require a supplement to ensure adequate levels. Infants who are exclusively breastfed and do not receive a daily vitamin D supplement are at a greater risk for rickets. Vitamin D is also important for immune system health, with Dr. Hope Simpson discovering as far back as 1945 that influenza outbreaks occurred in temperate regions during the fall and winter months and during the rainy seasons in the tropics. This led him to conclude that people tend to get the flu when sunlight is at its lowest levels. Children with low vitamin D status have a greater risk for allergies and respiratory infections and make 50% more trips to the emergency room for severe asthma attacks. The importance of vitamin D is increasingly recognized, and the American Academy of Pediatrics recently increased their recommendations for vitamin D3 to a minimum daily intake of 400 IU for all children and adolescents. Vitamin D is only naturally present in a handful of foods, including oily fish, beef, liver, cheese, egg yolks, and some mushrooms, but the best sources of vitamin D doesn't come from the diet at all. Sunlight is where the body gets most of its vitamin D, when conditions are optimal. Parents and guardians can also look to resources such as healthychildren.org to see if a child is getting enough or sufficient amounts of this vitamin. Breastfed and partially breastfed infants should be supplemented with 400 IU a day of vitamin D beginning in the first few days of life. All non-breastfed infants, as well as older children who are consuming less than 32 ounces, which is around a liter, per day of vitamin D fortified formula or milk, should receive a vitamin D supplement of 400 IU a day. Children with increased risk of vitamin D deficiency, such as those taking certain medications and with chronic diseases such as cystic fibrosis, may need higher doses of vitamin D. For children over 3 years old, and for the adolescents, a 400 to 800 IU chewable supplement is recommended per day. Although there are no known side effects at the recommended doses, vitamin D supplements should be kept out of the reach of children. The Vitamin D Council recommends that healthy children under the age of 1 have an intake of 1,000 IU per day of vitamin D, and that older children receive 1,000 IU for every 25 pounds of body weight.